And thanks so much for joining today's Google Hangout. On today's Hangout, we're going to discuss some important information for people who have Social Security and Medicare heading into next year. I'm sure that many of you have heard reports in the news that there will be no Social Security COLA next year, and you've probably also heard that Medicare costs may be going up. This afternoon, we have three invited experts who are going to get straight to the facts and tell you everything you need to know. Joining our conversation is Nancy Altman of Social Security Works, Joe Baker of the Medicare Rights Center, and Eva Dominguez of the Alliance for Retired Americans. Nancy, Joe, and Eva will talk about how these issues are playing out in Congress and how our organizations hope that legislation will change the healthcare cost picture for older adults and people with disabilities next year and into the future. We invite your questions during this conversation, and we will respond to them throughout the Google Hangout. Use the chat function on the right side of your screen to type in your questions. Nancy, Joe, and Eva, thank you so much for joining us. Nancy, let's start with the data released this morning about the Social Security COLA and the announcement in particular that there will be no Social Security COLA next year. Can you explain how this came to be and what it means for people who have Social Security?
Absolutely. Thank you so much, Stacy. I think you would be hard-pressed to find a senior who thinks that he or she has not seen their expenses go up this last year. This is only the third time in the history of automatic adjustments, starting back in 1975. This is only the third time that there has been no COLA. It comes about, a lot of people, all three times have come during the Obama administration, and some people have blamed the Democrats for this, but actually it's a mechanical formula. It's a flawed formula, but it's all done mechanically, and it has produced this crazy result of showing zero increase. So come January, when usually people see a cost, they will see none this year. And just one more point, this is really one of the most important features of Social Security. This is not a benefit increase. This is to prevent benefits from eroding over time. If you never had a inflation adjustment, then you would see after a number of years your benefits slowly and inexorably decline. So this is really intended to help seniors and people with disabilities, children, veterans, others who receive Social Security simply tread water. But what this zero COLA shows is that Congress has to act not just for this year, but to correct this inequity.
Great, thank you. And I know it's certainly true that the Medicare Rights Center and I know the Alliance for Retired Americans and Social Security Works regularly talk to people who feel like their expenses are going up and what they have from Social Security is already stretched too thin. So how can it be that this calculation results in no COLA next year? Can you explain this?
Yes, that is an excellent question. When Social Security was enacted, there wasn't a cost of living adjustment, and people had to wait for Congress to act. And they rarely acted every year. It was every other year, but sometimes, like in the 1940s, it was many years before there was a cost of living increase. So Congress in 1972 enacted an automatic adjustment because, as I say, this is simply to keep people whole, to make sure that the benefits don't erode. Now, at the time, back in 1972, our government, through the Bureau of Labor Statistics, was only producing one cost of living adjustment, and that was for urban workers and clerical workers. And as the name suggests, it looked at the expenses of workers. It didn't even include retirees, and it didn't include people in rural areas. Now, other indices have come along, but that is really the heart of the problem. The expenses that the general population, and workers in particular, and younger people face, they tend to be more, recreational and clothes and things where the costs are not going up as high. But seniors and people with disabilities disproportionately spend a lot of their income on medical care, on long-term care, and that's where inflation is very, very high. So the current cost of living adjustment can produce this crazy result of showing no inflation, yet because it is not tailored to seniors and people with disabilities and the costs that they experience.
And so, who are some of the people who will be most harmed by the absence of a COLA next year? Are there groups who will be more affected than others?
Yes. I mean, the Social Security is really important to almost everyone. 2/3 of seniors rely on Social Security for half or more of their income, but 1/3 of seniors rely on Social Security for virtually all of their income. So those people on very small fixed income, average benefits only about $16,000, they're going to be hurt very, very hard. Same thing with women, especially women disproportionately rely on Social Security because they did not have pension plans. They often, it's the pay inequity and so forth. They've been discriminated in the workplace. That's another group that disproportionately relies on Social Security. People of color, the same thing. LGBTQ, the same thing. It's groups that have been disadvantaged in the workplace that have tended to be more dependent on Social Security, that are more in need, that this part of their income, and as I say, it's not to say it's not a hardship for everyone, but it's especially hard for those groups.
Right. And it looks like we have a question from Scott here. He says, it looks like the current formula, as you've just discussed, it doesn't include the increase in drug costs or medical care. So he asks, how can we get a special index in for the elderly, a CPIE for seniors who are living in their homes and communities?
Well, the good news is that there have been about a half dozen bills introduced in Congress that do switch to the CPIE. I would say that that's really that's the minimum we should do, because even the CPIE does not fully reflect the costs of seniors because Congress never appropriated the money to really do a full study. But at least it's an improvement over the current cost of living adjustment. So that there should be, so the real answer, the good news is that we're heading into an election year, a presidential election year. Governor Martin O'Malley and Senator Bernie Sanders both have proposals to increase benefits across the board and put in the CPIE. The Republicans, an awful lot of the Republicans, Jeb Bush and Chris Christie and others, are talking about cutting benefits. Hillary Clinton, her position is, but every member of the House is up for election this year. You've got 1/3 of the Senate up. And this is a matter of values and choice. You'll hear a lot of, oh, we can't afford this program. We are the wealthiest nation of the world at the wealthiest point in our history. There's no question we can afford this. And beyond affording it, this is just common sense. If we're going to have a program that's indexed, we should have it as most accurately as possible. So I would urge anyone listening to contact their representative, their senators, and urge them at the minimum to push one of these pieces of legislation, to co-sponsor it, that switches to the CPIE.
Great, and we have another question here for you, Nancy, from Diane, and she asks, will there ever be an increase while you're collecting, in particular, Social Security disability?
That, again, is an excellent question because, of course, our country continues to get more and more wealthy. Now, many people don't realize that or feel it because over the last 20 or 30 years, all that wealth has gone to the top 1%. It has not been spread evenly, even among workers, in stagnant wages. But if we can ever get our elected officials to really lead on this important issue of income inequality, we will see a time where workers get the real product of their labor and see real wage increases. Now that doesn't help people on Social Security because once you're on Social Security, productivity and wages tend to go up faster than inflation, and all that Social Security does is go up with inflation, and as we know from today's announcement, it doesn't even do that. But that's what it does. But it is really time to expand these benefits. They have not been expanded for about 40 or 50 years, and as I say, we're much wealthier now than we were then. So the answer is we should all make our voices heard. Fortunately, I think we'll ask this question that this is, she's on the side of the overwhelming majority of American people. This has been a very heavily polled field, and everybody thinks it's time to expand Social Security. We've got to make sure that people in Washington hear that message.
Great, thank you so much. So Joe, now let's talk a little bit about Medicare costs for next year. So in particular, how does the absence of a Social Security COLA affect people's Medicare Part B premiums and also their Part B deductible?
Sure, thanks, Stacy. So every year, Medicare makes a determination about whether or not the Part B premium will change. Under law, federal law, the Part B premium, what consumers pay in as their part of the premium, has to equal 25% of the estimated cost of Part B for that year. So in other words, 75% of Part B costs are paid for by the general fund of money in the federal government and federal budget, and 25% come from the actual beneficiaries. People with Medicare pay that premium. That premium this year is $104.90. And it usually goes up a little bit every year because that 25%, that share goes up because costs go up. And Part B, if you recall, covers doctor services and other outpatient care in Medicare. Part A, different system, but part of Medicare covers hospital care. So the way COLA intersects this, and the fact that there's a no COLA here, means that another federal law comes into play, and that's basically called the hold harmless provision. And basically what that means is, if you're already in the Medicare program and you're already receiving Social Security income, you will be held harmless from any increase in the Part B premium. You will continue to pay $104.90 next year, and that's 70% of people with Medicare projected for next year. So 70% of people with Medicare next year will not see any increase in the Part B premium because there is a hold harmless provision there. That means, of course, what happens with the other 30%? Well, they will see a significant increase in their premium.
Okay, and so for the 30% of people who are not held harmless, how much is their premium going to go up?
It's going to go up a significant amount, an amount that we have not seen in at least the 10 or more years that I've been working in the Medicare program. It's a 52% increase, and it'll go up to $159.30 a month. And that will start for those folks as of January 1st, 2016, and continue through that year. It may go down in future years. It's an important thing to know because the 70% may pay more, say, in 2017, and so it'll all equalize. But for next year, if nothing's done, and we'll get to that in a moment, those 30% will pay about $159.30. I also need to caution that that number hasn't been really fixed yet by the Center for Medicare and Medicaid Services. So we will find out later this month probably exactly what amount it is, and we'll find out other cost-sharing information at that time as well. But right now it's estimated that the premium will go up to $159.30 unless the administration or Congress takes action to decrease it for that 30% of the population.
Okay, and so can you tell us who exactly is in that 30%?
Sure. There's a couple groups of folks in that 30%. One group are everybody that's new to Medicare next year. So if you're retiring next year, regardless of your income, regardless of who you are going to pay more for Medicare than folks that are already in the Medicare. You're going to pay that $159.30. The other group of people are people that are on the Medicare program but aren't taking their Social Security. So a lot of people, and they're paying premiums directly to Medicare, as it were, not having to deduct from their Social Security check because they're now taking Social Security. And that's a growing number of people because, well, first of all, it includes public employees, and I know Eve is going to talk about those, but it also includes people that are just waiting until 70 because they want to maximize their Social Security benefits. There's some folks that do that and continue to work and do it that way. The other group of people are high-income people. So those who are already paying higher income or higher premiums because they're higher income folks, well, the whole premium will go up even higher. And then finally, oddly enough, low-income people, people that are on the Medicaid program as well as Medicare, they will pay more, except they won't necessarily pay more. Their state Medicaid program will pay more for them, because that premium is subsidized by state Medicaid programs for people at or below 135% of the federal poverty level. So, you know, states are squawking about this too, because it's going to hit their bottom line budgets for those folks.
And so, I think premiums are not the only cost that people with Medicare pay. Or is it only the Part B premiums going up, or are there other cost increases that people should be aware of?
Well, everybody should be aware of one cost that we know is going up, and once again, we're not exactly sure that I'll give you an amount in a second, but this amount may change with the announcement that CMS, Center for Medicare and Medicaid Services, will make by the end of the month or beginning of next month. But the deductible is going up for all people with Medicare. So then what is a deductible? I think most folks know, but in any case, that is the amount of money you pay out of your own pocket before Medicare kicks in. And right now in the Medicare program, that's $147, and that is slated to go up to $223 if there's not action taken, or the Center for Medicare and Medicaid Services and Health and Human Services don't find some way to relieve or lower that number. And this doesn't affect everybody with Medicare. In the sense that some people have Medigap or retiree coverage that pays the deductible. Other people are enrolled in Medicare Advantage plans, and so they have this deductible either covered or partially covered. At the same time, even if folks do have insurance for this deductible, their premiums for that insurance may go up because the insurance company is paying more money out because that deductible went up. So, you know, if you don't see it one way, you'll see it the other way. And so this is not good news for everyone with Medicare, whether they're insured or not, and something that we're all working on in Washington to try to alleviate.
Great. And so, you know, you mentioned that a lot of people do have either a Medigap plan or a retiree plan to cover the deductible. So who's really going to be hit the hardest by this deductible increase?
Well, on the deductible side, I think the folks that will be hit the hardest are about 17 million people with Medicare that just have Medicare. You know, they go bare after that or with that. And what that means is they pay that out of their own pocket. They have no Medicare or Medicare supplemental coverage that pays the deductible. They have no Medicare Advantage that pays the deductible. They're not on Medicaid to have that deductible paid for, and so therefore that's money out of their pocket. And as Nancy was talking about earlier, they're not getting a COLA increase, but they're getting an increase in their Medicare deductible. So that's money out of their pocket that they can't be spending on all the other things that are increasing for seniors, and that is groceries, you know, rent, heating oil. I guess the oil stuff is a little not as volatile as it was, but it's going to get cold, right? So that's going to start being an expense. And, you know, finally, you know, as we were mentioning earlier, or one of our questioners, I think, had asked, prescription drug costs are not going anywhere but up. And, you know, people are paying out of pocket for those costs as well. The average senior in the Medicare program has an income under $24,000 a year and is already spending 15% of his or her income on medical costs. So as those costs increase, that percentage increases, and you can only stretch a dollar so far.
Okay, great. Well, let's go to one of our audience questions here. We have an important reminder from Juliana, who's asking us to tell people about the Medicare savings programs and the extra help programs. Can you tell people about where they might get some help?
Yeah, absolutely. So one of the big, as I said to you earlier, one of the big groups of people that is not subject to hold harmless, but is still kind of held harmless because they have their Part B premium paid for by Medicaid, are folks with Medicaid or folks who are in what's called the Medicare savings programs. And these programs basically pay, and it's a state federal program, pay for people's Part B premiums if they're under 135% of federal poverty. The Extra Help program is a program that subsidizes Part D prescription drug coverage for folks up to 155% of federal poverty. So if you're thinking, oh wow, do I qualify? Am I close to qualifying? Basically, for the Medicare savings programs for Part B to be subsidized, you were thinking for an individual about $22,000 a year in income or less. That's a lot of people. These programs are woefully undersubscribed. You know, all the people that are eligible for them aren't in them. So, you know, it's odds are on that you should, you know, apply. You can apply by calling your you know, your local Department for the Aging and finding out about them. You can call our helpline number, which I think we've posted in the Q&A box, but 800-333-4114, and we can hook you up with a local enroller, or we can help you walk through it.
Great, and there are, you know, counselors. The State Health Insurance Assistance Program is available to people because it can be hard to figure out if you might be eligible for these benefits. Can you talk about how people can find their SHIP counselor?
Yeah, I mean, certainly. You can call 1-800-SHIP-TALK and get access to the counselor is in your region. Get the phone number. You know, it's as simple as typing in elder care locator or, you know, SHIP, State Health Insurance Program, in your Google bar, and you'll get access to it. There are a lot of resources out there. You can also call 1-800-MEDICARE, and you can say, can you give me the local SHIP in my area? Give them the zip code, and they will give you that phone number. And then for the local SHIPs, you can walk in and meet with someone face-to-face, or you can do it over the phone, etc. So every state's rules are a little bit different. Some of them count assets, for example. One of the easiest ways to get into the Medicare Savings Program is to go through the Extra Help application process, and then you are automatically deemed in some instances for the Medicare Savings Programs. And 1-800-MEDICARE number can also access and help you access the Extra Help program.
Great, thank you. And here we have a question for Jim. I think he's asking, you know, is there any official information yet about the Part B premiums and the Part B deductible? And I think another question we're seeing is, when will we know?
Sure. As I said earlier, the information that I've given you about these numbers is unofficial. These are estimates based upon actuarial reports that came out over the summer. So a couple things. One is the Department of Health and Human Services and Center for Medicare and Medicaid Services won't announce until the end of the month the actual numbers for the Part B premium and deductible. So it should be the end of this month, beginning of next month, that we'll know for certain. The other thing is that we've heard from those agencies that they're working on ways of bringing these numbers down a little bit, of, you know, preventing this high an increase in both numbers. Whether they'll be successful at that or not, we don't know. We think, based on what we're hearing, that they'll only be able to bring them down a notch. But as you may have been reading in media reports, and there's an article in the New York Times today by Robert Pear about congressional efforts to intervene with legislation and make these numbers much, much lower, i.e. hold everybody harmless to the tune of $140.90 a month. So once again, as Nancy was saying earlier, this is a time when folks should be in touch with their their congressional representatives, be they you know, senators or folks in the House of Representatives, and pushing them to address this issue.
Great. Well, Eva, I know the Alliance for Retired Americans represents a lot of union retirees, you know, people who've spent their whole career working in the public sector. How will they be affected by these increased Medicare costs?
Yes, that's right, Stacy. There are 1.6 million public sector retirees that will be affected. And these are people who do not collect Social Security. So that's partly why they're affected, why they're not held harmless, is that they actually pay for their Medicare premiums separately. It's not drawn from their Social Security because they don't have Social Security. They're basically made up of teachers, firefighters, police, also federal retirees that participated under the old retirement system known as Civil Service Retirement System. They will also be affected. These individuals are really now going to have to figure out how they're going to make ends meet, how they're going to be able to budget, because what they're facing now is more than $700 a year in increased premiums and deductibles. So they're really going to have a hard time trying to figure out, especially if they've already been, you know, they've already been retired and have been participating in Medicare, and all of a sudden now they're going to get this unprecedented, whooping 52% increase in premiums and the deductible as well.
Thanks. Yeah, a lot of people definitely affected by these potential increases, and we'll talk a little bit more about what we're hoping Congress and the administration can do to address these potential increases. So today, it's a big day. We had no COLA announcement coming out from the Social Security Administration, but it's also important because today is the start of Medicare open enrollment, when people with Medicare can select among Part D prescription drug plans and Medicare Advantage plans. And going into open enrollment, it's definitely important for people to know what their overall healthcare costs are going to be. So knowing what they're going to pay in a Part B premium and deductible is important. But Eva, what are some of the other variables people with Medicare should think about as they weigh their coverage options during open enrollment?
Sure, absolutely, Stacy. Well, as you mentioned, today, October 15th, is the beginning of open enrollment, and the period will run through December 7th. This is a time for Medicare beneficiaries to be able to change health plans. And this means people who are on Part D plans can change their prescription drug plan, as well as those on those on Medicare Advantage plans. They can change to another plan if they would like. Medicare beneficiaries that have what's considered traditional Medicare at this time can change over to a Medicare Advantage plan, and vice versa. If you're on a Medicare Advantage plan, you can return to traditional Medicare. One of the things that that people need to think about is that even if they're happy with their plan, they need to, and this is happy with their prescription drug plan, they should check to make sure that there aren't other plans out there that might be better for them, that might be more cost effective. The drug plans can change their drug formularies. So you need to make sure that your drugs are still covered. That's really important. Also, premiums and coverage can be changed at this time. So it's really important to be able to look and compare with the different Part B plans. Similarly, Medicare Advantage plans at this point can change their providers. So make sure you check to see that your your medical provider, is still participating in the network. You should also make sure that your any deductibles, premiums, any deductibles, co-payments, or co-insurance that you have, check and see what it is for in-network and for out-of-networks, because those can change from year to year.
Great. Well, I know that we hear a lot from people who are concerned about the rising cost of prescription drugs, and that's been in the news a lot lately. So what, are some steps that people can take to make sure their Part D plan is affordable and covers as much of the cost as possible for them? And I think, this is really relevant for people who find themselves in the coverage gap or the donut hole. Is there any news about the donut hole that people should know as they think about selecting a Part D plan?
Yes. In 2016, the prescription drug donut hole, or the coverage gap, will start at $3,310 and go until you spend $4,850. Now, the Affordable Care Act requires that beneficiaries who fall in this donut hole are provided a drug discount from the pharmaceutical companies. And in 2016, the drug discount for brand name drugs will be 55%, and for generic drugs, it will be 42%. Also, in checking your plans, your drug plans, you should review to see if there are any special rules apply. Some drug plans actually require you to start taking an alternate medication before taking the drug that your physician has prescribed. This is called step therapy. And also, some plans may limit the quantity that you can get and may ask for prior authorization. Finally, be sure to check the plan's pharmacy network, both to make sure that the pharmacist that of your choice is on the plan, but also to check and see if you might have lower cost sharing by going to another pharmacy in your area. And also keep in mind that plans will provide prescription drugs through the mail, and that may be something that actually works out for you, that it makes it a little bit cheaper for you. So that's something to consider.
Great. And that is a lot for people to think about and consider. what kinds of resources can people reach out to so that someone, they can get help in considering all of these variables and making plan choices?
Sure. Well, the first thing that beneficiaries should do is look at their annual notice of change statement, and this is something that your plan should have sent it to you last month. And in this, there are details of any changes in premiums, providers, and coverage for your plan. You can also visit Medicare's website, the website for Plan Finder, and this will help you compare plans. You can reach out to as Joe mentioned earlier, you can reach out to your local state health insurance assistance program, also known as SHIP, and they will also help you compare plans. And finally, of course, you can also reach out to the Medicare Rights Center, their national helpline, to assist you. But to officially enroll, it's best that you call 1-800-MEDICARE. And when you do call and enroll, make sure you get a confirmation number, because if anything changes, if you have any problems with enrollment later on down the road, they will have a record of how, who you enrolled with and what your policy should look like.
Great. And if you look at the side of your screen, and we'll follow up as well, we're going to make sure that everyone has information for the Plan Finder, has the phone number for 1-800-MEDICARE, has the 1-800 phone number to locate their local SHIP, and then finally has the 1-800 number for the Medicare Rights Center. So among all of those resources, you should be able to get help here during open enrollment. And of course, you can also reach out to many of those groups if you have questions about the Part B premium and deductible increases we've talked about. And if you have any concerns, want to talk through your specific situation, all of those resources are available to you. So let's go back to our audience questions here. Eva, we have a comment from SB. His initials, or her initials here, saying, are seniors supposed to give up health care benefits or give up food or housing? Like, what are people supposed to do in the face of these rising costs? And, are these situations that you hear about among your members, that they're struggling to afford these basic needs?
Yes, absolutely. And this is definitely not anything new. We have heard it in the past. There are cases where seniors are splitting their pills or skipping, one day to try to have their medications last them longer. And that's not the way medications should be taken. So that's very dangerous and shouldn't be happening. And the truth is that seniors should not be in this quandary. And that's why we need to ask our members of Congress to help fix this. And I know we'll be talking about some of the bills that are out there to help take care of this problem. But no one should be, it's wonderful that 70% of beneficiaries are protected, but we really think 100% of beneficiaries should be protected.
That's great. Yeah, and I think that's a great segue to the next step in our conversation. Probably the most important part of our conversation is, what are we going to do about all of this, about the absence of the COLA and the rising Medicare costs? I know among our organizations, we've been sponsoring a petition to go to Congress, really encouraging them to take action. And to date, almost 100,000 people have signed this petition, which is great. And of course, we encourage everyone to keep signing and contact yourself, your member of Congress, about your concerns. But let's get into a little bit of the details about what exactly Congress can do and what the administration can do. And let's start first with the administration. So Joe, I think you've talked a lot about the Department of Health and Human Services and the Centers for Medicare and Medicaid Services ultimately announcing what the Part B premium and deductible will be. Is there anything they can do? Does the premium really have to be $159 a month and the deductible $223?
Evidently there is administrative action that they can take to somewhat decrease those amounts, both the Part B premium and the deductible. The wiggle room is partially, as far as we know, in what's called the contingency fund. So every year they have to estimate what the costs of Part B are going to be in the coming year, and they create a kind of reserve fund or a contingency fund in case they get it wrong and costs are higher. So one of the things that the Secretary of Health and Human Services could do is ratchet down that fund. And that would then decrease the amount of the Part B premium and the deductible. Of course, that may come back to haunt her, or if it's a him later, because those costs go up, and they, people still have to pay, the Part B premium still has to meet that 25% in future years. So there's not a lot of maneuverability here. There's some, but there isn't a lot. What we're really, I think, seeing as the primary solution to bring these numbers down to somewhere near affordable is to have congressional action. And that could take two forms. One is, a bill that would actually bring the premium down for everyone to $104.90, or once again have this 70-30 split, 70% at $104.90, and the 30% at some other number that's not $159. But certainly it would take an act of Congress to do that, and it's got to happen soon.
And Eva, do you agree with Bill? And can you tell us a little bit about where is Congress? Have they done anything yet on this issue?
Yes, absolutely. And just so you know, last week there were two complementary bills that were filed, one in the House and one in the Senate. Senator Ron Wyden from Oregon and Representative Dina Titus of Nevada both filed bills that would hold all Medicare beneficiaries harmless. So that would mean that all beneficiaries would pay $104.90 a month. And they would also be held harmless for the deductible part, the yearly deductible. The bills, let me just tell you, it's House Bill number 3696 and Senate Bill 2148. And there is a catch, though. First, Democrats and Republicans have to agree on how to pay for it. We think the conversation really needs to start with making sure that everyone is held harmless. It's also important to make sure that any fix that Congress comes up with doesn't shift costs onto beneficiaries, and this in the form of either higher premiums or higher cost sharing. We really need to keep the pressure on Congress to make sure that they act, and they act to the benefit of Medicare beneficiaries. That's why at this point I would like to urge everyone that's here listening to please contact your representatives and your senators and ask them to fix this problem, to make sure that all beneficiaries are held harmless. And if you want to mention the bill numbers, it's Senate Bill 2148 and House Bill 3696.
Great, thank you. So Nancy, I actually have a question here from Barry. He's pointed out that we also have to be worried about some of the conversations happening around the budget and the debt ceiling and how that might affect Social Security and Medicare. Do you want to weigh in on that?
Absolutely. That is an excellent question and an excellent concern. Social Security, as most people know, does not contribute a penny to the deficit. It cannot pay benefits unless it has sufficient costs to administer those benefits. And it has no borrowing authority. In fact, it ran a surplus, got an accumulated surplus of $2.8 trillion, and it's run a surplus every year. It's running a surplus this year. Nevertheless, there are those in Washington who want to cut the so-called entitlements, and it's a word that is used that really is Washington code for Social Security, Medicare, and Medicaid. They don't want to come out and say they want to cut these programs because there's so much resistance to doing it, but they talk about cutting it and then taking hostage a must-pass piece of legislation. So we need legislation before December 11th simply to keep the government running, so you can go to the parks and you can, we have our military and you have air controllers and you have testing of the food and all the kinds of things that government does. So that has to pass, and there's already talk about holding that hostage. And even before that, in early November, the government has to raise the debt limit, or we, or time in history, default on its debt, which is absurd. I mean, people have lent money to the government backed by the full faith and credit of the United States. That shouldn't happen, but it is a bargaining chip. It should be something that's routine, keeping the government open, making sure the debts are paid. but and it is the Republicans who want to hold these hostage to. They're talking about, for example, Mitch McConnell, the majority leader in the Senate, just talked about something called the chain CPI, which, if you can believe it, we're getting a zero COLA this year, and Mitch McConnell and others apparently think it's too generous because it's a more stingy measure of the current cost of living adjustment. There would be even more years of no COLA and lower COLAs if that were to go through. So again, it's something to keep our eyes on. And if I can add, there's another threat that's coming up a year from now, and again, it's a technical fix it's a technical thing where you have to rebalance the funds. There are two trust funds. That has to happen before the end of 2016, and there's already talk of that being held hostage. So this is government really doing its job. And again, it's important for, especially in this upcoming election year, for the American people to make their representatives know that they work for us and we expect them to do their job, and keep the government going, make sure that the government can pay its debts, make sure that Social Security can continue to pay its benefits, and not hold programs they don't like, Social Security and Medicare or Medicaid, hostage.
Great. Thank you. Well, so Joe, I have a question here from Samantha. She asks, Congress ends up lowering the amount of the Part B premium and the deductible, and I know Eva touched on this a little bit, but where will Congress get the money from? And if they end up lowering the premium and deductible, does that hurt the overall solvency or fiscal health of the Medicare program?
Yeah, and Stacey, I do want to deal with that question, but someone actually just wrote in on another line and wanted me to correct something which I misspoke about, and that is the how to get in touch with your SHIP program through the 800 number, through their own 800 number. And that number, and we'll post it, again, on where we're posting all these 800 numbers for help, but is 877-839-2675. So don't use that 1-800-SHIP-TALK number. That doesn't work anymore. This is the number. And you can get to your SHIP through this number I just said, or through 1-800-MEDICARE, or through our helpline here at the Medicare Rights Center. There's a lot of ways to get through to the SHIPs, and they're an incredible resource on the ground in every community. And so I'm sorry I got that number wrong. I should have known better. In any case, the issue with regard to Congress and the money is, where do they get the money? Well, we don't know. They've got a lot of different ideas for that every time something with regard to Medicare comes up. But what we want to be sure of, and as Eva had said, that it doesn't come off the back of, or land on the back of, or come out of the hide of people with Medicare themselves. So we don't want a situation where Congress says, okay, we're gonna lower the premium, we're gonna hold harmless, we're gonna save money for you over here, but we're gonna charge more money for you over here. That would not be, I think, a valuable or workable solution to this problem. We also have to remember, and in thinking about that this is probably a one-year problem, this level of increase to this small percentage of Medicare beneficiaries. This happened in 2010 and 2011. As Nancy was saying, there was no COLA back then. What happened was, once again, there were a group of people that paid more, a group that paid less, because Congress didn't act then. This differential wasn't as bad. And basically, it reverted back, not to the lower premium, but to a premium in the middle, because all 100% started to pay more, and those costs were shared amongst 100%. If that happened today, we would still see an increase to $120, which is still a pretty significant increase. And so, we do think Congress needs to look at this Part B premium. It needs to look at how this calculation is happening. I think the reality is that there's lots of other ways to get this paid for that wouldn't hurt seniors or coming out of their pockets. I mean, we can always look at the progressive tax system. Additionally, there are ways that the president has in each of his budgets has looked at prescription drug costs and reinstituting rebates for drug costs for dual eligibles, people eligible for both Medicare and Medicaid. That would cover this cost. So there's lots of other things that we could do besides cost, increase costs or drive revenue proposals that would hurt people with Medicare.
Great. Well, we're right here. We're about 40 minutes into our Google chat. So before we wrap up, I just want to give each of our speakers a chance to say any closing thoughts. Nancy, do you want to go ahead?
Yes, absolutely. Again, thank you for hosting this. I think this is crucial. And there's really a short-term issue and a long-term issue. And let me focus on Social Security, but it's true for Medicare as well. And we've been talking about the short-term problem of this not having a cost of living adjustment and its implications for Medicare premiums. That's the short-term problem. But the long-term problem is that both of these programs are inadequate. They should be expanded. Social Security should have, and there have been proposals to do this, to increase the level of benefits. A question before was about that. They have not been increased in decades. To increase these benefits and then come up with a better measure for cost of living. So when seniors' costs are really going up, they should have their benefits go up accordingly. And the same thing is true for Medicare. You can retire at age 62 under Social Security and continue to get benefits. It seems to me you should be able to get Medicare at age 62. Again, we are a wealthy country. This is a matter of values and a matter of choice. And those people who agree that we should be both expanding Social Security and Medicare, this is the year to make sure you join, as Senator Sanders talks about, a political revolution, and make sure your voices are heard on these important issues. Thank you.
And Eva, final thoughts from you?
Sure. I just want to again remind everyone that this is an extremely important issue for those beneficiaries that are going to be affected. Everyone that's on the call right now has the opportunity to make a difference, to call their member of Congress, call their, whether it's their senators or their representative, and let them know that they need to do something right now. It's a matter of priorities, and right now members of Congress need to stand up for their constituents, for seniors, for individuals with disabilities, and they need to set this straight. And one of the things, again, that they can do is sponsor these legislations that are out there. They can sponsor H.R. 3696 if they're in the House, or 2148 if they're in the Senate. And at the very least, they need to basically make sure that beneficiaries are protected both from the premiums and from the deductible. Thank you.
Great. Thank you, Eva. And Joe, any final thoughts?
Well, it's wonderful to have the last word. Thank you. But in any case, I don't have much more to say because even Nancy have laid it out so well. There is a short-term problem, as we've been talking, and as Nancy pointed out, and there's a longer-term issue about Medicare and Social Security. And the only way that we're really going to have a solution that is people-centric, consumer-centric, patient-centric, whatever you want, whatever term you want to use for this group of people or for us, as it were, is to make sure that we're involved with our elected officials and other governmental officials, making our voices heard, making sure that they know the problems that we're seeing or that we're dealing with in our own families, in our own organizations, in our own lives, and making those known. And so that is an important message in any season of the year, but particularly now and with a big election year ahead of us. I think the second thing is that we're going to have to stay in tune. We don't have a lot of answers, as you heard today. Things may very well change on a dime over the course of the next month, either for good or maybe not for so good. So keep informed. And finally, what I would say is that there is help out there, and Eva had talked about it, and I flubbed one of the numbers, but we'll get you the right numbers. There's lots of resources out there. If we are in the middle of the Medicare open enrollment period, people are making decisions about when to enroll in Social Security and whether or not they should delay or speed up that enrollment. Some of those decisions are very personal and involve a lot of your own information and feelings about those benefits, but there's a lot of information out there to help you make those decisions, and certainly you should avail yourself of it. talk to your family members. If you're a caregiver for someone, you're doing that job. Avail yourself of those resources, and those will be posted here. But once again, they're available, and please use them.
Yes. So thank you. A couple housekeeping things. We will definitely make all of the resources that we've talked about today available to you through the chat function, but we will also be sure to follow up. You should know that the Alliance for Retired Americans and Social Security Works and Medicare Rights Center are all resources available to you, and we all have wonderful listservs. Importantly, this recording will live on forever on the internet. You can watch it again and again. You can share it with your friends and family. There's a lot of information, so don't hesitate to visit YouTube and watch this again. And then finally, I just have to say thank you to our experts. We're very lucky to have Nancy and Eva and Joe with us today, who know so much and explain it so well. And thank you, of course, to all of you for spending your afternoon with us. We hope this has been helpful.
Thanks.
Thank you.
Thank you so much.
Thanks, Stacy.